Hi, I'm Alphonse DeLucia, and I am a cardiothoracic surgeon at Bronson as part of Bronson Cardiothoracic Surgeons, and I'm involved in the valve clinic here with Dr. Rogers.
I'm Christopher Rogers. I am an interventional cardiologist at Bronson Advanced Cardiac Healthcare. I work with my colleague Dr. DeLucia in the multidisciplinary valve clinic and the evaluation of patients with valvular heart disease. Multidisciplinary valve clinic is a clinic that has been established so that patients with severe valvular disease can be evaluated by both the interventional cardiologist and our cohort, Dr. DeLucia from cardiothoracic surgery, so we can choose and optimize the best approach for valve replacement therapy for that patient.
While the bulk of the patients that we see in the valve clinic are patients with aortic valve problems, it's not just limited to the aortic valve. We do see patients with other valvular problems or even sometimes valve problems associated with aneurysms, for example. And so there are other types of conditions that we do see in the valve clinic related to valvular disease.
One of the other key points too, having a multidisciplinary valve clinic where both the thoracic surgeon and the interventional cardiologist are present, is these patients are usually very, very ill. They are at a point in their disease process where expeditious or very timely evaluation and treatment and moving them right along to the actual procedure day is an extremely important part of the process, because the time from onset of symptoms to potentially devastating consequences of their valvular problem can sometimes be very short. And so having us together at the same time really truly helps to expedite the process so that we can move along quickly in their evaluation and then ultimately in their valve implantation.
When we first see patients at the valve clinic, they sometimes have a new diagnosis or an ongoing diagnosis of aortic valve problems. And we speak with the referring physicians, we collect all the information speaking with the patients, and then really decide, does the patient need an operation or a procedure at that point? Are they better suited for an open procedure, or should they be treated with a transcatheter valve? And that's really one of the key things of the multidisciplinary approach here, is that it's a cardiologist and a surgeon making the best possible recommendation to the patient as to how to proceed.
A TAVR procedure or transcatheter aortic valve replacement is a procedure that's been developed and out and available for the public since 2011. Transcatheter aortic valve replacement is a procedure that is less invasive than open surgical valve replacement, and we have multiple different options and approaches that we can utilize to implant the valve. So different than surgical valve replacement, where Dr. DeLucia would excise or cut the valve, the existing valve out and reimplant a new valve surgically, the transcatheter valve replacement actually is placed within the confines of the old valve, and the old valve is squeezed out of the way, and then the new valve begins to work. In Methodist Hospital, we've been doing transcatheter aortic valve replacements since 2012. Our first procedure was November 12th of 2012. We have a 97% success rate of valve implantation. Patients who have had a transcatheter aortic valve replacement have always felt a dramatic improvement in their symptoms. Their quality of life is dramatically improved, and they've been able to pursue much more active and a much more engaged lifestyle since their valve replacement therapy.
With that, often for these very sick patients, they are able to leave the hospital within a matter of a few days, usually 3 or 4 days. So that's been a great thing for patients that were really facing a gradual, steady decline in their function.
I mean, it's a huge team. It requires everyone's participation, and it's really turned out to be a very amazing and wonderful thing.